my name is Mallory, and I'm going to be your nurse today. I will be assessing your head, eyes, nose, ears, throat, and neck. What do you prefer I call you?
Evan.
Evan? So if you could go ahead and tell me your height and weight.
Yep, 6'1" and 177 pounds.
Okay, and so usually we'd use that to calculate your BMI, and to do that you would take the weight divided by the height squared, and you get that number, and it tells you, your index of if you're within normal range, underweight, etc. So I'm going to go ahead and look at your head. Your head is normal cephalic. It is midline. It's symmetric without any lesions or edema. It is appropriate for your ethnicity and matches the rest of your body. Your eyebrows are thick, evenly distributed without any scaling or flaking. There's no hair loss. Your eyelashes, they on your face are consistent with the rest of your body. The top eyelashes come out and up, and your bottom eyelashes come out and down. They're evenly distributed. I don't see any hair loss in any of them. Let's see, and then your conjunctiva is transparent. Your sclera is white. Your irises are blue. There's consistent markings throughout. The cornea and lens are free of opacities. And I'm also going to be checking to see that your pupils contract when I apply light. So I'm going to go ahead and dim the light.
Sounds good.
Okay, I'm going to go from shoulder across, and you can just go ahead and look forward. Okay. There was proper constriction. I'm also going to do an eye test, a close eye test. You're going to keep this 14 inches away, and if you can go ahead and point to the line that you are reading. You're going to keep 14 inches away.
Okay. 63925.
Next one.
42835. 374258. 9378828. ... 7 ...
Okay, so that is with both eyes. It is 20/25, and now I'm going to go ahead and have you put your hand over your right eye.
Okay.
And then do that again, which point
Do I hold the phone, or?
You can just point at which one you would.
Okay. 374258.
Okay, next line.
9378 ...
So 2032
on
your left eye, and now I'm going to cover your left eye and do the same thing.
374258. 537828.
And then you are 20/25 on your right eye. Thank you. What else? I'm also going to go ahead and do a peripheral vision test. So I'm going to go ahead and put my hands behind your head with my fingers wiggling, and when you can see it, just let me know.
Okay. Yep. Yep. Yep.
Peripheral vision is intact. So now I have one more test.
Okay.
I'm going to have you keep your head straight, and I'm going to have your eyes follow my finger.
Okay.
Okay. There wasn't extraocular movements, There's no stags present. And now we're going to take a look at your ears. If you can move your hair behind. Perfect. I'm going to go ahead and get on this side. Perfect. So your ears. You seem to have been communicating with me, so your hearing is intact.
Yeah.
There's other tests that would be done if you were not able to communicate with me, like the whispering test. You can go ahead. So the color is consistent with the rest of your body and your face and ethnicity. They're symmetrical. They are appropriate size, aligned with your eyes, so with the outer canvas of the eye. I'm going to go ahead and look inside the ear with the light.
Good luck.
Okay. There isn't any drainage, no bleeding, no foreign bodies present. Ear canal appears patent. Go ahead and look the other ear. There is no drainage, no bleeding, no lesions of either ear, no foreign bodies. The canal appears patent. Okay?
Alright.
Ears appear intact and no deformities present on the ears. For your nose the color is consistent with the rest of your body and your ethnicity. It's symmetrical. There doesn't appear to be any deformities, no lesions, no edema present within your nose, or around your nose, I should say. I'm going to go ahead and have you tilt your head back. I'm going to look inside your nose with my light. Okay. There's no exudates, no discharge, no foreign bodies present. Nasal passage also appears paid. So I'm going to go ahead, you can put your head back down. I'm going to have you cover one nostril and inhale. And then I'm going to go have you do that with the other. The nasal passage are patent and intact. Now I'll go to your mouth. Your lip color is pink, consistent with your skin tone. There's no lesions present. Lips are moist, they're not dry. I'm gonna go ahead and also look inside your mouth.
Tongue out or tongue in?
I'm gonna have you say,
Okay.
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 Okay, and then I'm gonna have you lift your tongue up. Okay. Can I have you smile? And then can I have you put your tongue out and back and forth? Go and then out, as far as you can go. Perfect, thank you. So the tongue, the oral mucosa was pink and moist I didn't see any lesions. The upper part of the mouth was also pink with no lesions. Below the tongue, I didn't see any lesions. It was pink, it was moist. The tonsils are present and appropriate size, I'd say about 2+. Your uvula was in the midline. It was pink, moist, and no lesions were present. I didn't see any exudates within your mouth, but I'm gonna go ahead and check one more time for lesions on the side of your tongue. So if you can go ahead and stick it out and put it to the side. Perfect. Perfect. I don't see any lesions on your tongue. Yeah, your uvula is midline. Tonsils are good. Everything's pink, moist. Your teeth, they were white without any misshaping. There was no missing teeth. There was no discoloration. Overall, everything looked pretty decent. There was no lesions on the tongue. Everything was pink, moist, smooth. On the top of your tongue, it was rough, as it should be, and moist and pink. And on the bottom, it was smooth, pink, and moist. I am now going to be looking at your neck. The color is consistent with the rest of your body and appropriate for your ethnicity. I don't see any bulging lumps. I don't see any masses. It's midline. The trachea, if you put your head back for me, please, is also midline. I'm also going to assess your lymph nodes, which, if you have an infection, can become inflamed. In most cases, they're either non-palpatable or they're small, rubbery, mobile and non-tender. So if you feel any tenderness, please let me know.
Okay.
I'm going to start by looking at your preocular nose, and then your postocular. This is your occipital, your tonsils, submandibular, or your submental, mandibular, your superficial anterior, and then you have your deep middle, and your superior clavicle, and your infraclavicle.
Gotcha.
Perfect. And I believe that is all that I have today. Maybe.
No tenderness.
Tenderness? Perfect.
Nope.
Thank you.
See you next time, Ryan.